Hi, this is Dr. Henshaw again, and the reason you have this video is that you were questioning exactly what is astigmatism. And you know, there's been a lot of things, a lot of ways that doctors in the past have tried to describe astigmatism. But actually, I think this might be the simplest way to look at it. Could you imagine that your eye is like a flat tire? It's round on the top and it's flat on the bottom. Well, if you have astigmatism, that is the shape of your eye. It's round on the top and flat on the bottom. However, I think you would agree with me, your eye does not rest on the curb like the wheels of your tire do. Therefore, that roundedness and flatness can be in different direction. It can be off to the side, it could be up and down, it could be like it is flat on the street like a flat tire is, or off in any direction. The treatment for that is to prescribe glasses that are shaped that way. They have the optical shape rather than just simply being a lens that makes it focus so you can focus better up close or up far away, but it compensates for that. Matter of fact, you've seen that type of lens in fun mirrors in the amusement park, because what they do is they grind astigmatism into that fun mirror, and that's why you see that distortion. What it does mean is some of you have a fairly high amount of the astigmatism. When you get the glasses for the first time, it can feel funny. You could feel taller, you could feel shorter, or you could actually, which has happened to me at one time, because I deal with astigmatism, I actually saw a telephone pole come straight up like this and then curve just like that as I walked out the door when I got one of my earlier pair of glasses. And yes, over a period of time, you do adapt to that and it does straighten out. So it's kind of nice to know that ahead of time before you get your glasses, rather than when you put them on and become shocked. And also, some of the time, there are things that we can do about astigmatism where we can prevent it. If it's a very small amount of astigmatism, you do not necessarily want to prescribe that amount of astigmatism, because astigmatism prescriptions some of the time are addictive, and then it gets worse and worse and worse. And so there are some things like lens therapy we can do in the early stages, and even vision therapy where we might be able to eliminate the astigmatism. So in your particular case, if we might be doing lens therapy with you. The assistant would then help you pick a pair of eyeglasses to solve that. Or if we were looking a little bit closer to see if there's more we can do with vision therapy, then we would be scheduling you for diagnostic testing.